and welcome to COVID-19 Talk with local health authorities. With me is, welcome back, Dr. David Persse, representing the city of Houston, and Dr. Umair Shah, representing Harris County. I want to thank you to the Rotary Club of Houston and past President Kathy Finninger for providing these questions. I'm Stephen Williams, Director of the Houston Health Department. Antibodies, first question. A study of almost 400,000 in England showed the antibody decline in COVID over 3 months. What does this new finding predict?
Well, what it suggests is that the people that have become infected, they will develop immunity, but it may be waning in a short number of months. So you can get reinfected. We've already seen people who have been reinfected. So
these are all antibody questions. The decrease in antibodies is said to be greater for those older and with less symptoms. Younger people have a slower loss of antibodies, and healthcare workers seem to retain their antibodies. Does that mean immunity will stay high if you have regular contact with the virus?
I don't know about, first of all, welcome back as well. I missed you. I don't know if immunity will stay high because of the last conclusion about regular contact, but it's really more the older the individual is that the real concern is that over time the immune system will start to wane, that the antibody protection will start to wane. So that I would say, but I'm not certain that the regular interaction would be a reason for that. What are your thoughts?
Yeah, so theoretically the healthcare workers should not be getting exposed because they've got all the precautions, so they should not be getting repeatedly exposed to the virus. But obviously if what the questioner is saying is true, that healthcare workers are maintaining their antibodies longer, that would suggest that they may be getting some minimal exposure, thereby invigorating the immune system to produce antibodies. But I don't know one way or the other with that. But and here's the other thing, is that your immunity is really dependent on the efficacy and the quantity of antibodies that your body's producing. So not only is it a question of how many antibodies you're producing, but are they really effective at stopping a new infection?
That's right. Now this is a controversial thing I'm about to say. Athletes should be good at physical and nutritional health because they're athletes. Healthcare workers should, in theory, be better at protecting themselves from the virus because they should know all the things that they should be doing. They know about the immune system and sleep and the importance of vitamins and all. So theoretically, there should be some important way that our healthcare workers should be stronger at protecting themselves from the virus, even if they have repetitive exposure. Now again, it's controversial because it's not unproven, it's just anecdotal, or not proven, it's anecdotal. But I do think that, if we think of an athlete being the best at the best in terms of physical health, a healthcare worker or a health worker should also be the best of the best in terms of fighting, taking all the preventive steps to fight the virus.
Still on antibodies. The New York Times reports new research in autoantibodies, like those impacting lupus and rheumatoid arthritis, that may be causing the body's defense system to shift into attacking itself. They use this to explain long haulers with lingering problems. Can you clarify? Could COVID cause an autoimmune disease?
Well, any foreign substance can trigger an autoimmune disease. And basically what an autoimmune disease is what the questioner put is when your own immune system misidentifies your own body as a foreign substance and attacks it. And so, in many of the autoimmune diseases, that's exactly what has happened. And there are lots of theories that sometimes people become exposed to something that then sets that in motion. So could coronavirus do that? Absolutely. It's totally theoretically possible. Is that what's causing the long haulers, the people with persistent symptoms? I don't know. I don't know that I've read that that's the problem.
Yeah.
Have you?
I haven't. No, I don't think that's the understanding of what long haulers are. In fact, I think it's unknown at this point. But the issue is really around, just as you said, is that the immune system, once it starts, over time, it's possible that there may be some virus or some particle that remains that your immune system continues to either revolve around, or it's already been set in motion and continues over time. And so I think it is something really of continued evolving science and trying to research it. Yeah.
Transmission. Texas public school information claims first weeks of report cards show more students failing than last year and struggling with virtual learning. An email surfaced in Austin school to gift students with a 70 because of no pass, no play rules. Mental health is important, but this doesn't seem like a good remedy. Your reaction? Actually, that's not a COVID question.
Not a COVID question, but I think it's this a related question, which is unfortunately a lot of the measures to really protect people from COVID-19, health and safety, have had other consequences, and I think it really impacts kids and in schools, and that's, I think, one of the biggest issues. And so I wouldn't be surprised that you would have, children who have had other consequences of those, and honestly, we won't know some of those effects for years.
Yeah, I think I'm going to defer the answering this question to the child psychologist and the education specialist, because you're balancing, the no pass no play rules in order to, it's a move to coerce, compel kids to get good grades if they want to be able to play, and there's utility in that. I mean, life is like that, right? I mean, if you don't perform, don't expect to get the reward. So that's a life lesson. And yet the kids are maybe not really responsible for the poor grades, maybe because of what's going on. Other kids are getting good grades. That's a very complicated question. I don't know the right course there.
Yeah.
Well, humidity may help prevent COVID. Should we be using ointment in a nasal passage to keep them moist?
I would say no. Humidity may slow down the virus because it's humidity in the environment that impedes the virus's ability to get into your nose. Once it's in your nose, which should be moist anyways, I don't know that additional moisture in your nose would, and an ointment, I don't think that's going to be helpful. What do you think?
I don't think so. I mean, in the past, you've had people that put the creams that are right in, but again, like you said, that these are aerosols. These are ways to get. So you can't put that. It's like you can block both of your nares and then you have nothing. Maybe if you block everything, which is what a mask does.
Yeah.
By the way,
say, with the mask on, my face and my nose are pretty moist. In fact,
exactly.
You can't see it, but most of my wrinkles have gone away.
Sure.
Actually, here
It's
I look
modified
30
Botox.
years younger, right in this area.
Okay, so the answer is no. That probably will not work.
That's right.
Absolutely. I would tell you to take the wrinkles off, but I meant your mask off so that we can look at your wrinkles, but no. I've heard 40% of the population has no symptoms. Is that accurate? Is that across all ages now? That's interesting.
Yeah, so I looked this up a while back. So that, for a while there we were saying that 40% of the population that was infected didn't have symptoms. And as the average age of the person who's infected has shifted lower, I want to say I read somewhere a couple weeks ago that it's actually increasing.
It's increasing.
Is that right?
That's right.
You read the same thing? Okay.
Yep. Yeah. Upwards. What I saw was upwards of half, so about 50%. So I still quote the 40% number because that's what I remember in more of a study standpoint. But I've actually seen anecdotally 40 to 50%. And you're right. I mean, the younger you are, the more likely you are to be exposed, have less symptoms or minimal symptoms, or blow off or forget those symptoms even exist, and dismiss them.
Still be able to spread the virus.
And still be able to spread the virus. That's why the masks are really important.
Thank you for joining us for COVID-19 Talk with local health authorities. We'll be right back.
Wash, washy, wash, washy, wash your hands. Scrub it while you sing this song. Wash, washy, wash, washy, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Welcome back to COVID-19 Talk with local health authorities, sponsored by the Rotary Club of Houston. Dr. Hotez said most COVID-19 cases are in poor living amongst the rich. Is the feeling that the poor do not utilize medical care or do not have access?
Well, that's true, and that complicates things, but the point is that poor people are poor because they tend to have minimum wage jobs. They tend to have multiple jobs. And they tend to be service-oriented jobs where they have a lot of exposure to people, whether it be waiting tables or whatever. And so that's where they have the increased risk of contracting the virus themselves. So it's not that, they don't have adequate health care. That's true. But going to the doctor is a good thing to do, but it doesn't prevent you from getting exposed to the virus at work or at play or by family members.
Well, I would just say that, inherently, we are all equally immune or potentially protected or at risk for this virus. It's not about poverty. It's not about, our color of our skin, our religion, our national origin, none of that. This is about our exposure. And really exposure, as you just said, when you're in certain jobs, occupations, you may be more likely to risk it because you have no choice. Or you may not be getting from your employer a mask. You may not be, you may be out and about and meeting people a lot, and you have no choice because you have to put food on the table. And so there's this economic piece of this, which is really markedly more at play, which we call social determining factors, social determinants of health, socioeconomic factors that are well beyond anything related to, to what the person was asking.
Yeah, it's a lot more complicated than just not accessing health care.
That's right.
Are we currently helping El Paso or other locations with hospital bed issues? It was mentioned they aren't testing much, so their numbers are even higher.
Yeah, so wearing my SETRAC hat, there is a plan in place. In fact, to my knowledge, we have received one patient from El Paso. Now that information is over 24 hours old, so there may have been more, but I think I would have been notified. But we've only received one. But we do have a plan in place. We have the pieces in place to transport patients. The state is facilitating that. And yes, there's also the issue that in El Paso, they had, compared to what we have here, much less testing going on. So there's two things about that. One is the question is that the situation may be worse than they thought in terms of the number of positive cases in the community. Now what's hospitalized is hospitalized. That's a solid number. We know that, right? But it may also be because they had less testing opportunity, that fewer people getting tested, which meant fewer people were able to isolate themselves and stop the spread of the virus. So that's the whole point about testing. It not just helps us get statistics, it helps you in case you're one of that 40 to 50% of people who are infected and don't know it. Then you know it, that you're infected, and you can stop spreading the virus.
That's right. That's right.
The positivity rate in the city went up last week from 5.6% to Monday's 6.5%. Mayor Turner said we could be facing the third wave. I thought we had to reach low single digits to move out of one wave. Where are we?
Well, we went from 20-something%. In some neighborhoods, it was over 30%. So we got down to, in the city, we got down to, we just touched 5%. And so now the numbers are starting they're going up. So again, we've been saying this again, don't rely on any one metric and don't pay attention to any one value within any one metric. It's the direction that things are going. Right now, the direction is that things have started going up. Now, they're not skyrocketing. The slope is not terribly steep just yet, but they're moving in the wrong direction.
That's right. The first wave was that March, April timeframe when you had a little bit of that
that was
increase.
A ripple.
It was a ripple, right? And so then we were able to again fight successfully as a community, as a region, this virus. And then you saw June, July where it went up markedly. Again, everybody got together. We fought this virus successfully, and it, as you said, went from those if you just look at one measure, positivity rate from that mid-20s down to single digits, 5-6%. And now we're starting to see this uptick. And I actually believe that we are in the third wave. Yeah.
Okay, Dr. Shah. Harris County's COVID-19, it actually says Dr. Shah.
Okay.
Harris County COVID-19 dashboard shows the 14-day average percent of positive tests at 7.4%. It appears we're second only to LA on confirmed cases. Why did the protocols for schools change?
Why did the protocols for schools change? I'm not sure I understand the question.
Well, there was an article in the paper and maybe on a news report that one of the school districts, HISD, had changed their protocols for closing schools.
Oh, okay. Okay.
The reality is that yes, they had met the metrics which would have indicated that they would have closed the schools, but when they looked at other factors, in this case, I think they had like four positive cases last week, and that wasn't really indicative of a situation where you needed to really close the whole district because of the 4 cases.
That's right.
4 confirmed cases, and I think they had some presumptive cases, but even the whole number, I think it was a little over a dozen, wouldn't have been an indication that the
so this
whole
is a
district
great
should
example
close.
where you need to look at the bigger picture, right?
That's right.
So they had 4 confirmed cases. They had maybe a dozen kids with symptoms that were not confirmed cases, and their protocol had been that when the positivity rate was above 7%, they would close the entire school system down. But that was out of context, and in fact, even when they put that together, they had no way of predicting what the situation was going to be now. So I don't fault HISD for putting together, and I really applaud them for having stopped, looked at the big picture, and then made a more informed decision.
That's right. And then as far as the Harris County piece goes, that, you know, I think as a community, again, I just said is that we have fought this virus successfully twice over. And when you look at us compared to other major metropolitan areas, we have been successful as a county, as even as a region. And I think that can't be underscored, but you can't just look at the total numbers. You have to look at things like the cases per population, a rate. And when you look at that, it gives you a different picture.
Yeah, and when you're talking about these various gauges, they are relative for the community or a certain jurisdiction, right?
That's
Not
right.
necessarily for a certain industry or a particular organization.
That's right. That's right. And it's also important to know that we have to look at, and I think our TMC partner said this a lot, and it was almost like you look at all the gauges as a cockpit of a pilot, and you look at all of them, and some will be going up, some will be going down, but you have to look at the summation of what's happening. That's not just the science. We talk about science of medicine, the art of medicine. It's the science of public health, but it's the art of public health of how you put that all together.
Yeah, I think with the public, what they're looking at is like a formula to dictate a certain behavior.
Yeah, but that's the problem. 2 things with that. One is if you marry yourself to a formula, it's like the phrase that the plan is nothing, but planning is everything.
That's
right? And so planning is important because that's where you learn, you strategize, you imagine, you make contingency plans. But on game day, it never matches your plan.
That's
so
right.
on game day, you've got to be able to pivot. You've got to be able to adjust.
That's right. And 5 years from now, let's say we get past this, and there's the next pandemic. We can look back today at 2020 and say, here's how we. But right now, we're still in the midst of it, so it's hard for us to now take those, those sort of proactive ways of looking at the playbook, because we are looking at proactively the playbook. But again, 5 years from now, we can look back and say, here's what the science showed us, because it's well after the fact.
Thank you for joining us for COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. We'll be right back.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information.
Now. Wash hands now. Wash hands now. Wash hands now. Hand washing is one of the best ways to stay healthy all year long.
My grandma always says everyone counts, and everyone who lives with us is special. Like my aunt, who took me on my first bus ride to the library, or my older cousin, who walked me to my first day of school, even my mom's friend and her baby who live with us.
The census informs funding for schools, roads, healthcare, and more. So count everyone in your home, including all children on the 2020 census. It's your chance to help them for the next 10 years. You can respond online, by phone, or by mail. Shape your future. Start here. Learn more at 2020census.gov.
Welcome back to COVID-19 Talk with Local Health Authorities. With me is Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. This is sponsored by the Rotary Club of Houston. Are hospitalizations higher in 40 to 60-year-olds?
The hospitalization rate's higher in 40 to 60-year-olds. You know, I looked at that data recently. I can't remember what it showed.
It is higher in the 21 to 40-year-olds. But 40 to 60-year-olds, I think it's holding steady, if I remember correctly.
Okay, so
Yeah.
maybe holding steady for 40 to
Yeah.
60-year-olds.
But the good news is that the 60 and above, those hospitalization numbers have gone down.
That's right.
That's the important news.
MSN.com said the long-term COVID case symptoms are worse than others, and those with ongoing fever and loss of appetite indicate a higher chance of hospitalization. Is that true?
Well, it depends on what you mean by long-term. So, in general, most patients who become infected and become symptomatic have mild symptoms for about a week. Some of them require hospitalizations, others don't. But at about the end of that first week, you either start getting better or you get worse. That's what I've been hearing. That's what from people I know who've been infected. That's what I've observed.
And I think it's important just to remember that this is evolving. You know, we're still seeing different populations, different parts of the world that are having different kinds of symptoms, and the kinds of symptoms that are maybe then being looked at from researchers to say, what is this a long-term issue? Is it a shorter term, medium term? So I think there's going to be additional information that's going to come out over the next several months to years.
Okay. Metrics. Positivity rates on wastewater map are increasing. Does this validate the other metrics we've been looking at for months?
I think it does. I think that when we see the positivity rate going up at the same time that we're finding increasing amounts of virus in the wastewater, I would expect those to be in parallel, and that's how they're behaving. So yeah, I think it validates each other. And remember, that's important because the advantage of wastewater is, at least within the city of Houston, it's all of our neighborhoods, right? And with testing, it's dependent on who goes to get tested. And for a while there, our testing numbers were going down, making me be concerned, a lot of us be concerned about its accuracy. And so the fact that we've got the wastewater to validate is really important.
No, I think it's when I think of Houston Health as from a leadership standpoint across the country with the wastewater surveillance project, I think that's really been something that other jurisdictions can learn from and can really look to really see how that helps validate what some of those, as you said, some of those changing numbers can look like. At least there's some consistency. Or the other consistency is around the hospital numbers, right? So the information that's when somebody presents to the hospital and what their numbers are, that's the other piece that is also important.
Dr. Persse, you said hospitalization rates are stable, and that is a lagging indicator. Is wastewater more of a leading indicator?
Yes, absolutely. Yeah, it is a leading indicator because we can get those results generally within a week of the samples being taken. And for the hospital, and like I said a moment ago, so for people who get infected, several days before they develop symptoms, then for about a week or so, most folks are having symptoms that are manageable at home.
That's right.
And they don't require a hospital. And then when they get sicker, they go to the hospital. So you can see there's at least 2 weeks lag there.
That's right.
Research out now has resurrected the theory about blood types. Patients with types O or B type has less severe COVID. Only 61% requires a ventilator versus 84% of type A or AB. Please explain.
Yeah, I'm going to make a general comment, David. I'll turn it to you. The general comment is that I've been watching this a bit, reading about it, and I am concerned that people are starting to say, well, look, if my blood type is this, I don't need to worry as much because I may not be at risk for complications or even getting the disease. And I think that's a mistake. And we want to make sure that people don't put their hat on, hey, because of my blood type, I'm either protected or not protected, and therefore don't take the precautions. Yeah. That's my general comment. Yeah.
Yeah. So the last time I looked at it, what struck me was a couple things. One was that O positive is the most common blood type. And the difference between the O positive and the A and the B folks in getting infected, if there is a difference, it wasn't huge, right? I mean, there may have been a difference there. In fact, there's a lot of debate as whether or not that difference was even real because it wasn't such a huge difference. So if you're somebody who's got A or B blood, I absolutely would not use that as a rereason to not wear a mask and risk getting sick.
I hadn't planned on that, David. Pfizer is stockpiling several 100,000 doses of the vaccine, and by the end of October, they supposedly will know if it works. Are all late-phase trials doing that? Some are.
Some are. I don't know if all are.
Yeah.
I don't know.
Yeah.
The
I mean, it's a
full
business
answer,
gamble. But
That's right, yeah.
Yeah. Some hospitals are preparing a special storage for vaccines. Do all vaccines require shipping in cold containers? If so, what will the challenges be to distribute the vaccine where needed? Why are the preparations for this vaccine as complex as this is just one of the many needing storage?
Well, there are 6 vaccine candidates out there. 5 of them require 2 doses. 1 requires 1 dose. And depending on which formulation, you've got cool storage versus deep cold storage. And so it's really about the difference in the vaccines. And the other thing that we don't know is which one is going to actually get through phase 3 first, what's going to be available. And the likelihood is that there's going to be a variety of formulations. You might have enough of this vaccine comes next, enough of this vaccine comes third, and we'll just have to really work through what those vaccine types that are available are.
Yeah.
What is an mRNA delivery mechanism?
So mRNA delivery mechanism is, if I'm understanding the question right, is there's one of the vaccines, at least one of the vaccines, is being done with this technology, and you'll be injected with a messenger RNA, and that will then get into the cells, and kind of like a virus, it gets into the cells. And so when you get infected with a virus, it goes into the cells, it takes over the RNA and DNA replication mechanism and starts making more virus. Well, what this will do is with the messenger RNA, it goes in, takes over that same mechanism, but it starts producing antibodies.
Oh.
And so that stimulates your body's, creates a new part of the immune system really for your own cell, body.
There are air purifiers that can be worn around your neck to create a 3-foot zone of clean air. Have you heard anything about how useful these are?
I haven't.
Not heard about that.
Yeah, I haven't. I mean, I would just say in general, let's just make sure we continue to remind ourselves that the most important thing is wearing your masks and social, physical distancing from others, and certainly those are probably the most important pieces. Now, air purifiers and what happens that, there may be some utility of it, but I would be careful not to put a complete confidence in those.
I'd be curious to see what that, because a 3-foot bubble around you is a lot of air.
Yeah.
And if this thing wears around your neck, I can't imagine it's small and lightweight. I mean, maybe it is, but that's a lot of air to be purifying.
Yeah.
Especially like even
walk
even
around
in
with a
here,
big device.
even in here where there's not a lot of breeze in this room, that's a lot of air to be purifying. So
Yeah.
that's an interesting device. I wonder how it works.
So what you're telling me is you really want to see it.
I need to. Well, more importantly, I want to see the data behind it.
Maybe that viewer can actually send the link and we can actually take a look at it. That'd be kind of cool.
Well, we'll do what you normally do, and that is Google it to see exactly what the literature is saying about it.
That's right.
Any closing words?
Well, look, I just want to say thank you to both of you. You guys have been fantastic. You've been colleagues and leaders as part of the response for months and months and months. And I just appreciate the opportunity to be here, the viewers to listen to us, and really just say that we're not through this pandemic, so please be careful over Halloween and the holidays.
So I would just say, to the audience is, thank you for watching, and I assume that we're sort of preaching to the choir, that the people that are watching this are watching because they're interested. But if we are on the advent of another wave, we need to get everybody. We've done it 2 times before. We need to get ahead of this thing. All right, the numbers are starting to go in the wrong direction. We know it's going to happen. We got to get ahead of this. We got to get more diligent right now.
Stay the course.
Yeah.
Thank you for joining us for COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. Joining with me was Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. I am Stephen Williams, the Director of the Houston Health Department. See you next week.